This is combining forms, suffixes, and prefixes on page 5. Presented in this section are lists of combining forms, suffixes, and prefixes that are commonly found in medical terms. Write the meaning of the medical term on the line that is provided. Some terms will be more difficult to understand even after you know the meanings of individual word parts. For these, more extensive explanations are given in italics. To check your work, see the mini dictionary beginning on page 353, which contains meanings of all the terms used in this book. Here is your study mantra: read, write, recite, and review. This is a proven method. It really works. Follow these simple steps. 1. Exercises and answers, pages 23 to 33. Write in this book and check your answers. Number 2, pronunciation of terms, page 34 to 37. Recite each term and write each meaning. 3. Practical applications and picture shows, pages 38 to 41. Read and write answers related to clinical settings and patient care. 4. Review, pages 42 to 44. Test yourself on all of the new word parts. And number 5, terminology checkup, pages 45 to 46. Make sure you get key concepts before leaving the chapter. So we're going to start with our combining forms, and you can see they have 3 columns here. They have first the combining form, then they have the meaning of that combining form, then they have the medical term, and you're supposed to write the meaning. I have the meanings on the slideshow already. Otherwise, it would be way too much writing for you throughout this chapter. I really want you to focus on the review activities. So we'll go through we'll go through first the combining forms. So we have the combining form of adeno, and this means gland. Then we have our medical term, adenoma, and it tells us that oma means tumor or mass. So adenoma is a tumor or mass of a gland. Then they have the term adenitis. They tell us itis means inflammation. So adenitis is inflammation of a gland. Then we have the combining form of arthro, and this means joint. Arthritis, so we know itis means inflammation, so arthritis is going to be inflammation of a joint. Then we have the combining form of bio, and this means life. The term biology tells us logi means the study of, so biology is the study of life. Biopsy tells us opsy means the process of viewing. So biopsy is process of viewing living tissue under a microscope. Then we have the combining form of carcino, which means cancer or cancerous. So carcinoma, we already found out above that oma means tumor or mass, so carcinoma is a cancerous tumor or mass. Then we have cardio, which means heart. So cardiology, study of the heart. Then we have cephalo. Cephalo means head. So cephalic tells us the suffix ic means pertaining to. If an infant is born with the head delivered first, it is a cephalic presentation. Cephalic means pertaining to the head. And we have cerebro. This refers to the cerebrum, the largest part of the brain. Cerebral, the suffix al also means pertaining to. So cerebral is pertaining to the cerebrum, which is the largest part of the brain. And tells us figure 1.1 shows the cerebrum and its functions. And this is shown on the bottom of page number 6. So some functions of the cerebrum, we have reading, vision, hearing, writing, sensations from body, movement, eye movement, thought processes, smell, and also speech. All right, our next term we have cerebrovascular accident, also known as CVA. And it tells us vascular means pertaining to blood vessels. A cerebrovascular accident means pertaining to a blood vessel accident of the cerebrum. CVA is a stroke, in other words. And it has a little side note here. What happens in a stroke? Blood containing oxygen and nutrients is necessary to keep all cells alive. When blood cannot reach areas of the cerebrum, brain cells die and their functions are lost. Depending on where those brain cells die determines what happens in a stroke. For example, loss of movement, loss of speech, and changes in sensation. All right, our next combining form we have cysto, and this means urinary bladder. So our term is cystoscope, and it tells us scope means instrument to visually examine. So cystoscope, instrument used to view the urinary bladder. It tells us figure 1-2 shows the urinary bladder and urinary tract in a male. Note that the prostate gland lies below the urinary bladder. It secretes fluid that combines with sperm to form semen. Semen leaves the body through the urethra during ejaculation. Then figure 1-3 on the bottom of page 7 shows a cystoscope placed through the urethra into the urinary bladder of a female during cystoscopy. So a cystoscope is placed into the urinary bladder through the urethra. Again, this is figure 1-3 on the bottom of page 7. All right, our next combining form we have cyto, which means cell. So cytology, this is the study of cells. Then we have dermo, which means skin. So dermal is pertaining to the skin. We also have dermato, which means skin as well. So dermatitis, inflammation of the skin. Our next combining form, we have electro, which we learned means electricity. So electrocardiogram, or ECG, or also EKG. So it tells us gram means record. So electrocardiogram, record of the electricity in the heart. Our next one, we have encephalo, which means brain. So their term, electroencephalogram, or EEG. An electroencephalogram is record of the electricity of the brain. This record is helpful in determining whether a patient has a seizure disorder such as epilepsy. Our next combining form, we have entero, which means intestines. This is often the small intestine. So our term, we have enteritis. This is inflammation of the intestines. Figure 1-4 shows the small and large intestines. Entero describes the small intestine and sometimes intestines in general. Colo and colono, other combining forms for the large intestine or colon. So figure 1-4 on the bottom of page 8 shows the location of the small and large intestines in the abdominal cavity. Note that the lungs, bronchial tubes, trachea, and esophagus are in the chest cavity, which is above the diaphragm. Our next combining form, we have urethro, which means red. So erythrocyte tells us cyte means cell. Erythrocyte are red blood cells. And figure 1-5 shows the 3 major types of blood cells. We have erythrocytes, we have leukocytes, which are white blood cells, and then we have thrombocytes, which are platelets. These are clotting cells. So our caption for 1.5, blood cells, erythrocytes, carry oxygen. Leukocytes, 5 different types, help fight disease, and thrombocytes or platelets help blood to clot. All right, top of page 10, we have the combining form gastro, which means stomach. Our term gastroscopy tells us scopy means process of visual examination using an instrument or scope. So gastroscopy, visual examination of the stomach. Then we have the combining form of noso, which means knowledge. Our term diagnosis tells us cis means state of, dia means complete. So diagnosis, complete knowledge gained after testing and examining the patient. The plural of diagnosis is diagnoses. And at the bottom of page 10, we have a little side note for our plurals. Terms ending in the letters IS, such as diagnosis and prognosis, form their plural by dropping the IS and adding ES. And if you flip to the appendix on page 325, you can see other rules on formation of plurals as well. All right, back to our combining forms. We have our term of prognosis. And it tells us pro means before. A prognosis is a prediction before knowledge that is made after the diagnosis. It forecasts the outcome of treatment. Then at the top of page 11, we have gyneco, which means woman or female. So gynecology, the study of female disorders. We have a little side note there. It says, be careful about spelling this term. The combining form is gyneco. A gynecologist specializes in diseases of the female reproductive organs. Gynecology involves both surgical and internal medicine expertise and is often practiced with obstetrics, which is the care of pregnant women and delivery of a fetus. Our next term we have, or our next combining forms, we have hemo and hemato, which both mean blood. Our term hemoglobin tells us globin means protein. So hemoglobin is the protein in red blood cells, which are erythrocytes, that helps carry oxygen in the blood. And hematoma, we know oma means mass or tumor. In this term, oma indicates a mass or swelling containing blood. So a hematoma is a mass containing blood, also known as a bruise. And then we have figure 1.7 on the top of page number 11. And you can see a picture of a hematoma from broken ribs. Our next combining term, we have hepato, and this means liver. Our medical term, hepatitis. This is the inflammation of the liver. This condition is often caused by different types of viruses, hepatitis A virus, hepatitis B virus, or the hepatitis C virus. And our side note on the bottom of page 11, what is a virus? A virus is a very small particle containing genetic material surrounded by a protein coat. Viruses infect cells and use the components of the host cell to make copies of themselves. Viral infections often result in the death of the host cell. Examples of viral diseases are hepatitis, AIDS, and COVID-19. We have figure 1.8, which shows two pictures. We have picture A is the representation of a coronavirus with protruding spikes. The name corona means crown and describes a group of viruses that have crown-like spikes on their surfaces. Then picture B, we have electron micrograph of coronaviruses. Then page 12, we have lapro. This is the abdomen or area between the chest and hip. So laparotomy tells us tomy means cutting into. So laparotomy is cutting into the abdomen. In an exploratory laparotomy, the surgeon makes a large incision in the abdominal wall to inspect organs for evidence of disease. This is shown in figure 1.7. We actually have figure 1.9, which shows two pictures for us. Picture A, laparotomy. This large incision was closed with surgical staples. And then we have picture B, laparoscopy. The abdomen is examined making small incisions and using a laparoscope. Our next combining form, we have laparo, which means abdomen, the area between the chest and the hip. So a laparotomy is going to mean cutting into the abdomen, since the tomy means cutting into. In an exploratory laparotomy, the surgeon makes a large incision in the abdomen wall to inspect organs for evidence of disease. Then we have leuco, which means white. Leukocyte is going to be a white blood cell. And figure 1.5 back on page 9 shows 5 different types of leukocytes. Neutrophils are the most numerous leukocytes. Next we have nephro, which means kidney. Our medical term, nephrectomy. Here it tells us ectomy means cutting out, an excision or resection of an organ or part of the body. So nephrectomy is cutting out of the kidney. Next we have neuro, which means nerve. So neurology is the study of nerves. Onco means tumor or cancerous. Our medical term, we have oncologist. An ist means a specialist. So an oncologist is going to be a physician who specializes in the study and treatment of tumors. Page 13, we have the combining term of ophthalmo. This means eye. So an ophthalmoscope is an instrument used to examine the eye. And we have figure 1.10, which shows us three pictures. Picture A is a picture of an ophthalmoscope. This instrument allows the ophthalmologist to view both the outer and inner areas of the eye. Picture B, ophthalmoscopic examination. And picture C, the inner or back area, the retina of a normal eye, as seen through an ophthalmoscope. Our next combining term, we have osteo, which means bone. Our medical term, osteoarthritis. This is the inflammation of bones and joints. Figure 111 on the bottom of page 13 shows a normal knee joint and a knee joint with osteoarthritis. Thinning and wearing down of cartilage, which is the connective tissue, occur as the condition progresses. Inflammation of the joint membrane occurs late in the disease. So your normal joint is shown in the left image, and then the joint with osteoarthritis is shown in the right. Our next combining term, we have patho, which means disease. So a pathologist is a specialist of the study of diseases. So it's a medical doctor who views biopsy samples to make a diagnosis and examines dead bodies in autopsies to determine the cause of death. Aut means self, and opsy means the process of viewing. So an autopsy is an opportunity to see for oneself what caused a patient's death. And our side note at the bottom of page 14, pathologist, medical examiner, and coroner. A medical examiner, or ME, is a pathologist who specializes in forensic medicine related to criminal issues. A coroner, however, is an elected official who investigates any suspicious death. This official may or may not be a medical examiner. Our next combining term, we have psycho, which means mind. Our medical term, psychosis. Osis means abnormal condition. In this serious mental condition, the patient loses touch with reality. Psychotic symptoms include hallucinations, which are unreal sensory perceptions, such as hearing voices when none are present, and also delusions, which are fixed false beliefs that can't be changed by logical reasoning. So psychosis, again, abnormal condition of the mind. Next we have reno, which means kidney. And our medical term is renal. This means pertaining to the kidneys. Sometimes there are two combining forms for the same part of the body. Often one comes from Latin and the other from Greek. Ren is the Latin root meaning kidney, and nepher is the Greek word meaning kidney. The Greek root describes abnormal conditions and procedures, whereas the Latin root is used with al, meaning pertaining to. Next we have rhino, which means nose. So rhinitis is the inflammation of the nose. The next combining term, we have sarco, which means flesh. So sarcoma is a tumor or mass of fleshy connective tissues. Sarcomas and carcinomas are both cancerous, malignant tumors. Sarcomas grow from the fleshy connective tissues of the body, such as bone, fat, muscle, and cartilage, whereas carcinomas arise from skin tissue and the linings of internal organs. So figure 112 on the top of page 15, we have two pictures. Picture A shows sarcoma of the bone, which is osteosarcoma. Sarcomas grow from connective supportive tissues such as bone, fat, muscle, and cartilage. And then picture B, we have basal cell carcinoma. This type of skin cancer grows from linings of the skin. Other carcinomas come from cells that line internal organs and glands within the body. Our next combining term, we have thrombo, which means clotting. So a thrombocyte is a cell that helps blood to clot. Another word for thrombocyte is a platelet. And figure 113, figure 15 back on page 9 shows images of platelets. Our next medical term, we also have thrombosis. Thrombosis is the condition of forming a clot. So formation of a thrombus or blood clot occurs when thrombocytes, proteins, and other blood cells stick together. Figure 113 on the bottom of page 15 shows a thrombus or blood clot. Thrombosis describes the condition of forming a clot. If a piece of clot breaks off and travels elsewhere, it is called an embolus. A pulmonary embolus may start from a clot in the leg and travel to block a blood vessel in the lung. Remember that pulmono, coming from that term pulmonary, pulmono means lung. Okay, next, starting on page 16, we have suffixes. Each suffix is in bold in the suffix column and underlined in the medical term column. So our first suffix, we have al, and this means pertaining to. Our medical term, we have neural, so this means pertaining to nerves. Next, we have algia. This is a condition of pain. So arthralgia is the pain of joints. Next is cyte. Cyte means cell. So leukocyte is a white blood cell. Our next suffix, ectomy. This is the cutting out, removal, or excision. So gastrectomy, the cutting out of stomach. In a partial or subtotal gastrectomy, only a portion of the stomach is removed. Next we have emia, which means blood condition. So leukemia, blood condition of cancerous white blood cells. Large numbers of immature cancerous cells are found in the bloodstream and bone marrow, the inner part of the bone that makes blood cells. Our next suffix, globin. This means protein. So hemoglobin, we know hemo means blood. So hemoglobin, blood protein. Gram, this means record. So an arthrogram is an X-ray record of a joint. The letters IA, ia, this means condition. So neuralgia is condition of nerve pain. Then we have IC, ick. Again, this means pertaining to. Gastric, pertaining to the stomach. And then ism means condition or process. So our medical term, hyperthyroidism. Hyper means excessive. The thyroid gland is in the neck. It secretes the hormone thyroxine, which helps cells burn food to release energy. So hyperthyroidism, condition of excessive hormone secretion in the thyroid gland. And down at the bottom of page 16, we have figure 114, hyperthyroidism. This is also known as Graves' disease. Notice the enlarged thyroid gland. It produces too much hormone, which causes rapid pulse, nervousness, excessive sweating, and swelling of tissue behind the eyeball. And this results in a bulging of the eyes. Our next suffix, we have itis. We learned that this means inflammation. So gastroenteritis, inflammation of the stomach and intestines. Logist, this means specialist in the study of. So neurologist, specialist in the study of nerves, brain, and spinal cord. Logy means study of. So nephrology is the study of the kidneys. And we have a table at the bottom of page 17, table 1.1. This has a list of other terms using the suffix of logy. We have cardiology, study of the heart, dermatology, study of the skin, endocrinology, study of the endocrine glands, gastroenterology is the study of the stomach and intestines, gynecology, study of women and women's diseases, hematology, study of the blood, neurology, study of the nerves and the brain and spinal cord, oncology, study of tumors, cancerous or malignant diseases, ophthalmology, study of the eye, pathology, study of disease, psychology, study of the mind and mental disorders, rheumatology, study of joint diseases. So rheumato means flow or watery discharge, which was once thought to cause aches and pains, especially in joints. And then lastly, we have urology, is the study of the urinary tract. Back up to our suffixes, we have oma. We know now that this means tumor or mass. So hepatoma is a cancerous tumor of the liver. It's also called hepatocellular carcinoma. Our suffix opsy means to view. So biopsy is to view living tissue under a microscope. And then we have the suffix of osis, which means abnormal condition. So our medical term nephrosis, abnormal condition of the kidneys. We also have leukocytosis. This is a slight increase in the number of normal white blood cells as a response to infection. Our suffix scope is an instrument to visually examine. So gastroscope, an instrument to examine the stomach. Scopy is the process, laparoscope, the instrument to examine the abdomen. Next we have scopy, the process of visual examination. So laparoscopy, small incisions are made near the navel and instruments are inserted into the abdomen for viewing organs and performing procedures such as tying off the fallopian or uterine tubes. So we have figure 115, laparoscopy for tubal ligation, interruption of the continuity of the fallopian tubes as a means of preventing future pregnancy. The vaginal speculum keeps the vaginal cavity open. The uterine cannula is a tube placed into the uterus to manipulate the uterus during the procedure. Forceps are used for grasping or manipulating tissue. So another term for this that we know of is getting your tubes tied. Our next medical term, we have arthroscopy. And this is the process of visual examination of a joint. In figure 116, we have an image of arthroscopy of the shoulder. A surgeon, orthopedist, performs an arthroscopic examination to make a diagnosis or treat disease of the joints. Our next suffix, we have cis, which means state of. So prognosis, prediction that is made after the diagnosis. It forecasts the outcome of treatment. And then our last suffix, either tomy or tomy, process of cutting into or incision. So we have neurotomy, and this is the incision of a nerve. Next, we'll go through some prefixes starting on page 19. Each prefix is in bold in the prefix column and also underlined in the medical term column. So our prefixes, we have a or an, and this means no or not. So our medical term anemia, it literally means a condition of no blood. So that's the literal translation of it, no blood. It's actually a decrease in the number of red blood cells, or in hemoglobin, the protein that helps erythrocytes carry oxygen. And our side note at the bottom of page 19, where is the root? Some suffixes can contain roots. In the term anemia, notice that the root em from heme, meaning blood, is embedded in the suffix emia. Our next prefix, we have aut, which means self. So autopsy, viewing and examining a dead body with one's own or self eyes. Here the root ops, which means viewing, is embedded in the suffix opsy, which means process of viewing. Next we have dia, which means complete or through, and our term diagnosis, complete knowledge of patient's condition. So in this term, dia means complete. Then we have diameter, which is the measurement of the line passing through the center of a circle. So here, our suffix meter means measurement, and dia means through in this particular term. Next we have dys, dys. This means bad, painful, difficult, or abnormal. So dysentery is a condition of painful intestines. So our suffix here, the letter y, means condition or process. Next we have endo. This means within. So our term endocrine glands. Crino means to secrete, to form and give off. Examples of endocrine glands are the thyroid gland, pituitary gland, adrenal glands, ovaries, and testes. All of these glands secrete hormones within the body and into the bloodstream. So again, endocrine glands are organs that secrete hormones within the body. Then we have endocardium. And the endocardium is a layer of tissue lining the chambers and valves within the heart. So the suffix means a structure. Next we have epi. This means above, upon, or on. So epigastric means above the stomach. And then we have exo. This means outside. The exocrine glands are glands that secrete outside of the body. An examples of exocrine glands are sweat, tear, and mammary or breast glands. These secrete substances to the outside of the body. Next, we have hyper. This means excessive, more than normal, or too much. Our medical term, hyperglycemia. Glyco means sugar. Hyperglycemia may be a sign of diabetes mellitus. Mellitus means sweet. So hyperglycemia, blood condition of excessive sugar. Then we have hypo. This means below, less than normal, or under. So hypoglycemia, blood condition of less than normal sugar. This condition results from too much insulin in the bloodstream. Symptoms are weakness, headache, and hunger. Then we have pan. This means all. And our medical term, pandemic. Demo means people. COVID-19 is a pandemic disease that in 2020 spread all through the world, causing millions of infections and deaths. However, an epidemic is a disease that has spread to many people, but within a limited or confined area. Next, we have peri, and this means surrounding. The pericardium is the membrane surrounding the heart. Oh, and I forgot our little side note for hyperglycemia down at the bottom of page 20. So hyperglycemia and diabetes. People with hyperglycemia lack insulin, this is type 1 diabetes, or have ineffective insulin, which is type 2 diabetes. Insulin is a hormone normally released by the pancreas, an endocrine gland near the stomach. Insulin allows sugar to leave the bloodstream and enter cells. When insulin is either absent or not working, sugar remains in the blood, resulting in hyperglycemia and diabetes. And we actually have a little in-person story that we'll get to in a couple of pages about a person living with type 1 diabetes. Pro means before or forward. So the prostate gland, this is the male gland that surrounds the base of the urinary bladder and it produces semen. This exocrine gland stands, this comes from the part in prostate of state, before or in front of the urinary bladder in males. And in figure 117, we have a transurethral resection of the prostate, also known as TURP. The resectoscope contains a light, valves for controlling irrigating fluid, and an electrical loop that cuts tissue and seals blood vessels. Our next suffix, we have re, which means back. Resection. So here section means cutting into an organ, but resection means removing some or all of an organ in the sense of cutting back or away. The Latin resectio means a trimming or pruning. Then we have retro, which means behind. And our medical term, retrogastric. This means pertaining to behind the stomach. And then we have sub, which means below or under. So subhepatic, pertaining to below the liver. And trans, we have across or through. So transdermal, pertaining to through the skin. And then transurethral would be pertaining to through the urethra. And the urethra is a tube that leads from the urinary bladder to the outside of the body. A transurethral resection of the prostate gland, also known as TURP. This is a surgical procedure to remove non-cancerous or benign growth of the prostate gland. Pieces of the enlarged gland are removed through the urethra. Next on page 22, we have a little story. This is In Person Living with Diabetes. Jake Sheldon has type 1 diabetes, which was diagnosed when he was 8 years old. The following narrative was written by his mother, Ruth Ellen Sheldon. As a teenager, Jake's diabetes, or T1D, morning routine involved testing his blood sugar by pricking his finger and sticking a test strip into the drop of blood. Then he would insert the strip into a handheld glucometer and wait 3 to 5 seconds for a blood sugar reading. If this was 120 milligrams per deciliter or higher, he would give himself insulin through his pump 10 to 15 minutes before breakfast. The pump calculated the amount of insulin required to cover the carbs and any extra insulin needed to bring down a high blood sugar. The insulin pump was connected to his body with a small cannula or tube, delivering fast-acting insulin under the skin into his hip region. His pump was always connected to him with plastic tubing, and he carried it with him in his pants pocket. When he bathed, he disconnected the pump, and when he slept, he placed it on the mattress next to his body. When playing sports, Jake timed his meals with the start of the activity, so his blood sugar was around 150 milligrams per deciliter. He disconnected his pump during sports, and at halftime he tested his blood sugar. If it was low, he needed to eat. If it was high, he needed to reconnect his pump and administer more insulin. During these teenage years, Jake's diabetes didn't disrupt his life other than the nighttime checks, wearing an insulin pump, and paying attention to how many carbs he ate. We encouraged him to make good nutritional choices, not always easy for a kid, and to limit certain foods, such as donuts, Slurpees, candy, for special occasions. He carried a glucometer with him at all times and sugar to take when his blood glucose was low. Today, Jake, now 25 years old, lives and works in New York City. He wears a tandem slim insulin pump, which communicates directly with his Dexcom G6 continuous glucose monitor. The Dexcom system includes a blood sugar monitoring sensor so that he inserts it into his abdomen every 10 days. Jake no longer has to prick his finger as often. The CGM tests his blood sugar levels continuously and sends his blood sugar levels to his iPhone. His Dexcom system also sends his blood sugar levels to his insulin pump, inserted by a cannula on his rear hip. If Jake's blood sugar is high, his insulin pump knows to increase his bolus rates to decrease his blood sugar levels. If Jake's blood sugar is low, his insulin pump will decrease his insulin flow to help increase his blood sugar levels. The communication between the insulin pump and the CGM helps keep Jake's blood sugar in range overnight when he sleeps. Jake continues to count his carbohydrates eaten at each meal and still computes the amount of insulin needed to cover these carbohydrates. Jake also still carries a sugar source and his glucometer in case of a malfunctioning CGM reading with him wherever he goes. Today's technology lessens the burden of living with type 1 diabetes, but his blood sugar levels still need to be closely monitored and managed.